Okay, all of us are hurrying and scurrying about right now, enjoying the holiday season, which is always one of the most wonderful times of the year, as the song says. But it can also be a time where the weather might not be so good. The leaves are still on your front walk, and that can be an easy way for you to fall. We're just a bit distracted when we're driving. Injuries can happen before you know it. So thank goodness Regena Young is here. She's with Erlanger Health Systems, and she's going to talk about things that they're kind of raising awareness of when it comes to injury prevention. November 18th is kind of a magical day for you. It's the day set aside for this, right?
Absolutely. So November 18th is National Injury Prevention Day, and the goal is to raise awareness. It's a public health concern when it comes to injuries. Injuries are the #1 cause of unintentional death from birth until 44 years of age. And then we also have components. When folks get older, falls can be a significant impact and injury causing problem. Not only are they having to survive those types of injuries, but they may actually die because of a brain injury that they received during that fall.
You know, it's just such a hard thing because we all know as we get older, the life can change on a dime, right? And when that happens to you, and we've all had a near miss probably out there, and you pause for a minute and your heart races and you think, oh, it could have been so much worse.
Absolutely.
And yet somehow we don't really learn from that. We still fall back into that risky behavior.
You're absolutely right. When it comes to injury and injury prevention, folks don't realize it's a national epidemic that actually injures and kills more people than other disease processes together. And that's why at our Level 1 Trauma Center, we have an injury prevention coordinator. My job is to go out into the community and educate via classes, doing health fairs, doing talks at different conferences, and really focus on injury prevention activities. And we base that on the injuries that we see at Erlanger, whether that be falls, which is our #1 cause of traumatic injury, driving safety. We see a lot of motorcycle and motor vehicle crashes. We also have a program called Stop the Bleed, where we teach you how to respond to life-threatening bleeding. So if an injury actually occurs, you know what to do. And then we've got a new focus on firearm safety, which is very important and definitely something that we want to address in our community.
You know, I'll want to focus on the driving for just a minute.
Sure.
Because most of us hopefully know the whole never text and drive and being careful about being on your phone. The laws are in place to really reinforce that.
Right.
None of us around here want to drive in the snow. We're very quick to stay home. Yet we've got leaves on the ground, wet weather that rolls around, and those leaves are every bit as slippery as ice on the road.
Absolutely. You can quote hydroplane on leaves that are slick. Absolutely. Some of the other things to consider are drowsy driving. That can be just as deadly as drinking and driving.
Right.
And we focus on our teens and young adults because that is your highest risk factor. But we also have a program called Car Fit that we do where we focus on senior drivers, just making sure that their car fits them, especially with all the new gadgets and warning systems that come with our newer vehicles. We want to make sure that the steering wheel is the right distance from somebody's chest, that it's in the right angle, that they've got their side view mirrors at the right angle where they can see the backs of their vehicle, that they know how to utilize all those crash avoidance systems. So that's another program we have out.
You know, I'm so old school. My car is old and I don't have a warning system. Like when I back up, I don't have the rear view mirror. And I do not enjoy driving other cars when it beeps at me. It startles me more than anything. You can disengage those, I think.
Some of them you can, absolutely.
Yeah,
absolutely, especially like your lane.
Yeah, I kind of like that feature. It's just the backing up where the minute I hit it to go in reverse, beep, 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 it goes at me and I can't stand it. We're going to be putting up Christmas lights and Christmas trees. you got to watch those ladders.
Absolutely. Falls are our #1 cause of injury, and that is for all age groups. It's not just our seniors. You certainly have folks that are working in trees, that are working on their roof, that are working at construction that have significant falls and significant injuries that can occur from that.
I only have a couple of minutes left, Regena, but does it start with, I mean, this is obvious, but we don't do it, of assessing the project at hand and making sure you're starting it safely before you begin?
Absolutely, taking all the safety measures you can. There are always those funny memes of where someone's leaning off a scaffolding or leaning off a ladder that's teetering, and what we want to do is make sure that you're sure-footed. If you need a brace to hold you in place or a cable to hold you in place for safety, do those things, especially when it comes to working on a house or working in industry.
Because you're seeing it every day at Erlanger.
Absolutely.
The disastrous effect of not taking that precaution.
Absolutely. That's what we're there for, but we would much rather someone be safe and avoid coming to see us.
So on November 18th, is there anything going on at Erlanger specifically that day?
We'll be posting on social media talking about the different programs that we offer and how you can request them for yourself or for your organization. We also will be doing a Go Green. So there's a green light. If you really are very injury prevention focused, you can change your light bulbs to green and light it up. That's the goal for the celebration this year.
Okay. Wonderful to have you here.
Well, thank you so much, Julie. I always enjoy coming.
You're a very good advocate. So you can get in touch with Regena. Her email is there on your screen. She is part of the wonderful group at Erlanger Health Systems. Her job, as she said, is to get out there and keep our community safe. Back after this.
Hey, Dina's sick with a fever. Who do I call?
I'll call Day Owl Mobile Urgent Care. They'll be there soon.
Avoid the waiting room. Call Day Owl Mobile Urgent Care. Call today and we'll see you within the hour. Day Owl Mobile Urgent Care, the wise choice.
It's twice as nice at the new Mango's in Red Bank. Mango's showroom is twice the size, twice the sofas and chairs, twice the dining tables, twice the lamps. More of all the decor that makes a house a warm, inviting home. Buy one item or the whole room. Mango's selection can update any room in your home. And don't forget the jewelry and candles for gift giving.
Come see us at Mango's.
Cute name, great prices for everything in your home.
Ice on the Landing returns to the Chattanooga Choo Choo November 18th through January 29th. Great outdoor fun for all ages.
My name is Jacqueline, and I was on Dr. DeRusa's program for 9 months, and I lost 70 pounds. Celebrating my 60th birthday is a